Hello everyone, I'm Mohammad Imran, your host for today's webinar. I'm working as a project manager in delivering creative solutions with more than 5 years of experience in VR and AR industry. I'm super excited for today's webinar, not just for today's webinar, but for the series of webinars coming ahead. Before we get into the discussion, I would like to tell you that these webinars will be of episodes. In each episode, we will deeply dive into the topic and explore the possibilities of VR in various sectors. So, without further ado, I welcome you all to the first webinar episode of virtual reality in medical and health sector. So, today we'll be discussing on how VR technology is revolutionizing the healthcare industry and transforming the way we approach the patient care. So, just before we dive into the virtual reality topic in medical, let's first define what virtual reality is. Okay, so virtual reality, most of us believe that this technology is a new one, a modern technology, but we have to understand that this is not a new technology. It's a way old technology, but at that time there were limitations for the technology, so it was not at full-fledged and available for everyone. So Ivan Suthar, along with his student Bob Sproul, were the first to create the virtual reality. As you can see on the screen, that how the first head-mounted virtual reality set would look like. So it was called as sort of domicile. This is what the beginning of the virtual reality would look like. So what is virtual reality? Virtual reality, or commonly known as VR, in short form, is a computer-generated three-dimensional environment that can be interacted with using specified equipment such as headset or VR box. Now, you may be wondering, how does VR relate to healthcare? Well, the answer is simple. VR technology allows healthcare professionals to simulate medical procedures and scenarios in a safe and controlled environment. And this will be happening without putting the patients at risk. So, what will be the medical applications of virtual reality? As you can see on the screen, the virtual reality and augmented reality can be used in medical education, surgery, and the treatment of various phobias, ADHD. Okay. So let's consider medical education. So for medical education, VR can be used to practice surgical procedures. So this will be allowing the medical students to develop the skills and confidence that they need before they even step into the operation theater. So not only just that, VR can be used to simulate emergency situations such as heart attack or primary health care or first aid. So these things will be helpful so that the healthcare professionals can practice this and their response time increases. And this will be making sure that they are ready to handle the real life situations. So how does virtual reality actually help the medical students? It can help them via surgical trainings and via practice of different medical procedures. So what are the main benefits of students using virtual reality in medicine? So medical students will be having a realistic, immersive, and interactive training experience. It can help them practice medical procedures and surgeries without risking the life of the patients. So medical education and the students, they can use the VR to learn anatomy, and they can practice like surgical techniques, and even learn how to respond to medical emergencies. So, not only just in the medical emergencies, VR technology can be used in different sectors of medical. So one of the example which I would like to discuss here is mental health treatment. So how does mental health treatment can be implemented using the use of virtual reality and augmented reality? So VR can be very effective tool for treating mental health disorders. It could be social anxiety, it could be PTSD, it could be phobias. So patients can use the VR to comfort their fears. This could be done in a safe and controlled environment. I'll be giving an example soon. And mental health professionals, they can use the VR technology to guide their patients through the treatment process. Let's take an example as acrophobia. Acrophobia is a phobia where the patient has the fear of heights. So VR can be used to create a level-based treatment where an environment is created based on level where the user progresses step by step to overcome his fear. So there are like already several apps available which helps in treating different phobias. So does VR only helps in treatment of anxiety, PTSD or phobias? The interesting fact is that VR and AR can also be helpful in pain management. Seems superficial, but it is fact. Pain is realistic and virtual reality is virtual, but still pain management can be done using virtual reality, and it has been continuously happening in the medical sectors. So how can pain management can be taken place in virtual reality? So VR can be used to distract patients from pain during medical procedures such as dressing changes, injections, and dental procedures. It can also be used to manage chronic pain by providing a relaxing and immersive environment. Not only just that, VR also plays a very prominent role in rehabilitation. So we might have known to these situations where patients need to get rehabilitated back to the situation. There are like different scenarios like reduction of the addiction of some unnecessary things and getting back to the normal physical forms after having a mishap or an incident. So how VR can be helpful for this? So VR can be used to aid the physical rehabilitation. How? By providing an interactive exercises, and these activities will be simulating the real world environments. So patients can use the VR to practice balance while they're walking or like managing or for the coordination and movements. And this technology can be used to monitor the progress, and it can be adjusted based on the progress of the patient. So not only just that, but VR and AR can play a very crucial role in one of the medical streams which is very, very important these days, and it is nomenclatured as telemedicine. It might be sounding new to most of the people, but still telemedicine is a real factor. So we have come across so many situations that medical facility is not available for remote areas. So though medical sector has advanced a lot in these decades, it's still far from reach to some people and some remote areas. Here, VR can be used for remote consultation and diagnosis, which can be especially helpful for the patients who are not able to travel to a healthcare facility. Patients can use VR to interact with healthcare professionals in the real time, while doctors can also use the VR to examine patients virtually. This is what is called as like telemedicine. So we have been discussing about how virtual reality can be used in medicine. So we have already discussed about surgery and how surgery can be benefited using the virtual reality technology. I'll be coming back to that point once again, but wait. It's not just that medical professionals who benefit from the virtual reality technology. Patients can also use the virtual reality technology, like we have discussed, for management of pain, anxiety, and other conditions. For example, VR can be used to distract patients during painful procedures such as chemotherapy, as this will be helpful to reduce the discomfort and anxiety. Now you might be thinking, are there any risks using the virtual reality technology? Unfortunately, of course, like any other technology, there are some risks associated with using of the virtual reality and augmented reality. For instance, some patients may experience motion sickness or other side effects from using VR equipment. This happens when a user is unaware of VR tech, or maybe he's using for the first time. So when I came into the VR industry and when I was experiencing the VR, trust me, I too had like the concussion and a little bit of headache for a couple of days while I was testing few modules. But later on, it became so easy for me that I do not find any issues with using of VR. So it is a myth that you will be having a long-term issues while using VR, based on the timely management usage of VR will be always beneficial. But the benefits of VR in healthcare are numerous. The technology, as it is rapidly advancing, as VR technology becomes like more accessible and more affordable, we can expect to see even more innovative uses in healthcare and in near future. And those are the topics which we will be discussing in depth in our upcoming episodes, because this is going to be an introductory session anyways. So virtual reality is transforming the way we approach patient in medicine and healthcare, from training medical professionals to managing patient pain, anxiety. The applications of VR are vast and promising, especially in medical industry. We hope we hope that the development of AR and VR continues in the same stream. So once again, I'll be coming back to the topic which we have on the screen, which is surgery. So one of the interesting usage of virtual reality which I came across was brain hemorrhage patients. So when a patient is supposed to have a brain surgery, they get anxious about it. Anxiety a lot for them, and this might affect the patient's stress levels, and that could be lethal for patient during surgery. So what doctors has done, along with the help of VR technologies, they take the scanning of CT scan of the brain and convert that into a 3D model and explain the same thing to the patient. Once the patient understands the condition and the procedure, they eases out, and the process of surgery takes place in a proper way. That's a fantastic use of virtual reality. Here, not only we are just using it for surgery, but we are also using it to calm down the patient. So for in-depth understanding and detailed explanation of these topics will be taken care in upcoming episodes. So please make sure that whoever are attending the introductory webinar right now, please make sure to attend all the upcoming episodes of VR in medical and healthcare. So that is it for now. Let's have a small briefing on what we have discussed. So what is the virtual reality, and when did this technology came into emergence, and what are the benefits of virtual reality in medical and health sector? It can be used in medical education, surgery, telemedicine, medicine manufacturing, and first aid and training purposes. So I hope that you have found this webinar informative, that you are inspired to explore the possibilities of virtual reality in your own practices. This is what David has been doing. We at David have created numerous health-related virtual reality and augmented reality applications, which not only helps the medical sector, but also cuts down the cost of that particular practices and the procedures by providing an immersive experience, and yet it is flexible for any user to understand. I have worked with several international clients for creating medical applications for education purpose and augmented reality anatomy explanation applications and many more. So in episode 2, we will be choosing a specific topic from the topics which we have discussed today, and we'll have an in-depth detailed webinar, and the series will be continuing on so on. After the webinar series, we will be continuing the web series. We'll be continuing the webinar series on different topics. It could be automotive industry, it could be infrastructure industry, it could be business development. So wherever the virtual reality is creating its impact, we'll be having an in-depth, detailed webinar series answering all the queries and everything. So I would like to know if you have any questions or queries. Just let me stop my screen once. So till now, I would like to ask if you have any queries or questions till what we have discussed. If you have any questions, you can just like put up in the question and answer sections. I'll be more than happy to answer the question. Well, thank you for joining the webinar. I'll be more than happy to see you in upcoming episodes of virtual reality in medical and healthcare. Thank you and have a great day. Thank you for your time.